Okay. So I checked myself into the UCI Medical Center. And I mean, I was surprised how fast they did things and got me into, so, I mean, first thing when they checked my temperature and my blood pressure, I mean, immediately, they moved me to the back. So, I mean, I was in the back, and then that was it. I had a whole bunch of, machines, echocardiograms, ultrasounds, and, everything. So, they did everything within a couple of hours that, unfortunately, in Mexico was done to me within months. I was like amused, that, I mean, all the machines were brought to me, I had everything done right there. So, sure enough, they admitted me, they put me up in a room. Then I meet my cardiologist, Dr. Matiku. He explained to me, that I was in really, really bad condition. That they were talking to see, what my options were going to be, and apparently I did have some stones in my gallbladder. I confirmed it. But Dr. Matiku explained to me, surgeons were just not going to do surgery on me. And he told me that, if I were put into a surgery, most likely I wasn't going to, make it. So, I mean, it hit me then. It really, really hit me then that, that I knew that I had a really serious heart condition, I mean, nobody had ever explained to me or said anything about numbers, the ejection fraction number. Nobody had actually, said anything to me about that in Mexico. Well, apparently, mine was at 9.6. So, I mean, he explained to me that that was, really bad. And that I was not going to be able to be left out of the hospital, and that either they would have to do surgery if my gallbladder got really bad, but I was at risk, or wait it off, to see how things went. And, to just fast forward all this, they ended up deciding to put a defibrillator and pacemaker. Usually it's one or the other. And he said to me, that, I was getting both in one, 2-in-1, defibrillator and a pacemaker. So I end up getting my implant in July 25th, I believe. Yeah, July 25th. And, this is my scar. It's just a little scar. You can't see it because of the light. Okay, there you go. Right here. So the defibrillator is right here. You can touch it. It's right here. So, a couple of days after that, I mean, just that second day after waking up, after having this done, it felt different. I felt different. what they explained to me that the defibrillator does, it does like little shocks in the heart, because he explained to me that my heart, when your ejection fraction is like really low, or it's not pumping right, you know, that the heart pumps on the top like this, and then, you know, on the top and on the bottom, and, you know, normal would be this, but mine was actually like, so apparently it paces it or something, so it makes it so the heart keeps pumping, you know. So, well, let me tell you, as soon as when I got out of the hospital, it was like I felt so different, you know. I didn't feel like I was, you know, that I wasn't able to breathe, that I couldn't sleep at night, that, you know. Well, I'm sorry, let me stop right there. While I was in the hospital during this time, you know, since I was checked in until I was checked out, they put me on medication for diuretics, because apparently I had about 16 liters of extra fluid in my body. So basically I was like drowning, you know. That's why I wasn't unable to breathe. And since my heart was not pumping correctly, the fluid was backing up. And it was literally killing me. So, you know, instantly, I mean, I was off the oxygen completely, you know, while in the hospital, you know. There's a couple times at the beginning, I remember, that they'd go and shake me while I was asleep, you know. For some reason, I guess I stopped breathing or something. So they would, you know, Miss Lobera, you know. So, but like I say, you know, it was it was totally different once I got out, you know. The doctor also explained to me that I was going to have to look into getting advanced therapy, because, you know, eventually my heart was going to get tired. While I was there in the hospital, one of my nurses, well, she was a nurse practitioner. I mean, which I adore. Her name is Tamara Shaker. She was the best, you know. I mean, everybody there treated me, you know, so kind, and were so concerned, and they said I was the baby on the floor. So I mean, imagine that, you know, a lot of older people. You know, I didn't get a chance to see them because I actually never left the room. But she went in there and she was so nice to me. And, you know, I guess she felt for me because she saw that, you know, I wasn't that, you know, old and, you know, having to go through this. But I mean, there's a lot of people that, you know, like I've seen, you know, there's really young people that go through this, you know, and there's older people, and, you know, but I guess she got really interested in my case, and I guess, you know, she felt sorry for me, I guess. I don't know, you know. The thing was that she was really nice, and she was very helpful, and you know, and she explained a lot of things to me. So let me get back.